Okay, so this video is going to show you how I gap and shear the lumbar spine. So by gapping, I actually bring the pelvis down and I get on the bottom portion of the pokey part of the spine. I want to feel, does it come up towards me? Okay, so I'm gapping that. What I'm feeling is right here at L5, it doesn't want to lift up. All right, so that would be an area of interest for me that I want to treat. So to do that, I'm bringing her pelvis right until I feel that barrier. Don't let me pull you down here, Keely. Just hold your pelvis right there. Good. And let it go. And I'm just going to take up the slack as she lets it go. Good. And hold again. Don't let me pull you down. Very good. And let it go. Very good. And I'm taking up the slack and I'm getting a good amount of mobility there, so I can go back and check that. And that's a bit more motion. All right. Now, if I'm looking at shearing or more of the ability for the vertebrae to drop down towards the table, I'm actually going to start on the sacrum here, and that is really stiff. So if I was doing an SI joint video right now, which was last month, I would really be working on that. But for the sake of the lumbar spine, when I feel L5 drops down, no problem. Ooh, I get to L4 and that's really stiff. L3 is really stiff. L2. So really I could work on L4, 3, 2, and even up to L1 is also really stiff. So just to show you on L4, I'm going to get right on the top of the pokey part of that bone, and then I would really work on bringing her pelvis up until I feel that resistance. I'll say, hold here, Keely, don't let me push you up anymore. And I would engage kind of the resistance into my finger there. And slowly let it go. Let me push you up. Good. And I'll take up that slack there. And I would do that over and over again until I wasn't getting any more improvement in that range, and let it go. Okay. So that's an example of how I could gap and shear the pelvis in this positioning. Okay. Or I'm sorry, gap and shear the lumbar spine in this position.